Post-stroke mood and emotional disturbances, pharmacological therapy based on mechanisms. Jong S. Kim. Additional article information. Abstract. Post-stroke mood and emotional disturbances are frequent and diverse in their manifestations. Out of the many post-stroke disturbances, post-stroke depression, post-stroke anxiety, post-stroke emotional incontinence, post-stroke anger proneness, and post-stroke fatigue are frequent and important symptoms. These symptoms are distressing for both the patients and their caregivers, and negatively influence the patient's quality of life. Unfortunately, these emotional disturbances are not apparent and are therefore often unnoticed by busy clinicians. Their phenomenology, predicting factors, and pathophysiology have been understudied and are under-recognized. In addition, well-designed clinical trials regarding these symptoms are rare. Fortunately, these mood and emotional disturbances may be treated or prevented by various methods, including pharmacological therapy. To administer the appropriate therapy, we have to understand the phenomenology and the similarities and differences in the pathophysiological mechanisms associated with these emotional symptoms. This narrative review will describe some of the most common or relevant post-stroke mood and emotional disturbances. The phenomenology, factors or predictors, and relevant lesion locations will be described, and pharmacological treatment of these emotional disturbances will be discussed based on presumable pathophysiological mechanisms. Keywords: stroke, depression, emotion, serotonin, treatment. Introduction. Mood and emotional disturbances are frequent symptoms in stroke survivors. 1. These symptoms are distressing for both the patients and their caregivers, and negatively influence patient quality of life. 2. 3 important mood/emotional disturbances include post-stroke depression (PSD), post-stroke anxiety, post-stroke emotional incontinence (SE), post-stroke anger proneness (SAP), and post-stroke fatigue (PSF). Underlying factors and predictors of these emotional disturbances partially overlap, but are still different. The relationships between these phenomena and lesion locations differ when considering the different emotional symptoms. Thus, these diverse emotional disturbances are pathophysiologically interrelated, but are different phenomena. Studies have shown that these emotional disturbances have negative impacts on patients' clinical outcomes. PSD, for example, negatively influences later functional outcomes after stroke. 4-8 decreases quality of life. 9 leads to less efficient use of rehabilitation services. 8 and increases mortality. 10-11 patients with PSF are more often unemployed, change their jobs. 12-13 and fail to return to previous jobs. 13-16 than those without PSF. Although the overall negative impacts of SE and SAP are less marked than those of PSD, they still lead to distress and embarrassment, impair certain domains of patients' quality of life, and increase caregiver burden. 17. Fortunately, these mood and emotional disturbances can be treated or prevented by various methods, including pharmacological therapy. In order to administer the proper therapy, we have to understand the similarities and differences between the phenomenologies and pathophysiological mechanisms associated with these symptoms. Regrettably, these important symptoms have been underdiagnosed, neglected, and understudied. This narrative review will describe some of the most common or relevant post-stroke mood and emotional disturbances. The phenomenology, underlying factors or predictors, and relevant lesion locations will be described. I will also discuss pharmacological treatments for these emotional disturbances based on presumable pathophysiological mechanisms. Depression and depressive mood. Symptom characteristics and prevalence. The symptoms of post-stroke depression or depressive symptoms include depressed mood,